Good afternoon, my name is Chris. I'll be your student physical therapist for today's session. Can I go ahead and get your name and date of birth? Don't say anything. You're good. Okay, I just want to verify you are who I meant to see. Okay, so we're just going to run through some cranial nerve testing. That's not to say that anything is abnormal or anything. I just want to make sure that we're good neurologically before we move forward. Okay, so I have the first one we're going to be testing is olfactory, which is just basically your sense. So I have 2 scents here, and then what we're going to do is you're going to close your eyes and you're going to plug one nose, and I'm going to hold up one to one nostril. You're going to smell it and you're going to say what it is or what you think it is. Okay? Go ahead and close your eyes. Go ahead and inhale.
Cinnamon sugar.
Cinnamon sugar, okay. And then plug the other nose. Go ahead and inhale.
Vanilla.
Okay, perfect. So that one's working perfectly. The next one we'll move on to is your optic nerve, which is cranial nerve 2. So for this one, we're going to be testing the visual fields. So I just have some sticks here. And then what I'm going to do is I'm going to kind of bring it into focus. Whenever I bring it into focus, once you're going to be staring at my nose, basically. Once you see it out of your periphery, then just say yes, or left or right, or which color. Okay? So I'm going to come back here, and then once you see something, go ahead and say.
Red. Red. Green. Red.
Okay, perfect. That was good. You didn't deviate at all. You stared right at my nose. Okay, the third one, we're going to do oculomotor. So for this one, I'm going to test your pupillary constriction. And so for this one, go ahead and cover one eye. We're going to test one eye for now. Go ahead and just stare straight at me. Good, we have constriction on that side. So then we're gonna go here, because I want to see if this one constricts while I shine the light in this one. Okay, perfect. So they're symmetrical. They both constricted at the same time, which is normal. And then we're gonna go ahead and go on to cranial nerve 4, which is the trochlear. So what we're going to do now is we're going to do an H pattern. So I'll use this one so I don't use the light. So what I'm going to do is you're just going to go ahead and stare at this little circle right here. I'm just going to make an H pattern and then try and follow it with just your eyes. So we're going to keep your head straight forward and follow it with just your eyes. Okay, perfect. Good job. Okay, now we're going to move on to cranial nerve 5, the trigeminal nerve. So this one, I'm just going to test the sensation on your face. So what I'm going to do is we're going to close your eyes, and then I'm just going to touch. And then if you feel a touch, just go ahead and say yes. If you don't feel anything, obviously don't say anything. Okay, ready?
Yes. 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 Yes.
Okay, perfect. So now what we're going to do is we're going to go on to cranial nerve 6, which is abducens. Now what we're going to do is I'm going to have you do saccades, which is basically I'm going to hold these 2 objects about 2 feet apart, and then what you're going to do is when I say green, you're going to look at green, and when I say red, you're going to immediately shift to red. Okay? So we'll go here and we'll go green. You can keep staring at it. Red, green, red, green, red, perfect. And then there, we're just looking for any delayed reactions or hypo or hypermetria, which means you're either overshooting the object or undershooting the object, which I didn't see any of that. And even if you did, it wouldn't be super abnormal because I do that too. Okay, so now we're gonna go on to cranial nerve 7, which is the facial nerve. So with this one, we're just gonna be testing the musculature in the face. So I'm just gonna have you do different like emotional faces.
Mhm.
So the first one we can go eyebrows raised. Good, and then make an angry face, a happy face, and then pucker lips. Okay, perfect. And then we can go on to vestibular cochlear, which this one is, I'm just going to go ahead and test your hearing a little bit. So what I'm going to have you do is close your eyes, and then I'm going to attempt to make a noise somehow, and then if you hear it, go ahead and say which side, and just say yes or no, or like left side, right side. Close your eyes.
Right. Left. Left. Right.
Okay, perfect. So now we can go on to cranial nerve 9, glossopharyngeal. So what I'm gonna have you do now is I'm gonna have you go ahead and say whenever I shine the light in your mouth, and I just want to see the reflex of the palate is all I'm doing. Okay, so I go ahead and open, and then go ahead and say ah. Relax. One more time. Okay, perfect. Everything's normal there. And then, so for cranial nerve 10, that's more of an autonomic nervous system nerve. So I would just ask you questions like how's your digestive been lately? Like normal bowel movements, things like that. Heart rate is okay. Blood pressure, things like that. And if not, I would go ahead and take your blood pressure. It might be low with a high heart rate, or even reversed. So like a high heart rate or low heart rate with a high blood pressure. And then for cranial nerve 11, the accessory nerve, I'm just gonna go ahead and make sure that you can look all the way to the right. So no, with your head, sorry. Okay, go ahead and look the other way. Good there. Back to the middle. Go ahead and shrug your shoulders as high as you can. Good. Okay, relax. Now go ahead and I'm gonna try and turn your head that way. Don't let me, okay? So we're gonna go here. Good. Good. And then go ahead and shrug your shoulders again. Don't let me push them down. Okay, perfect. Is there any pain with any of that? Okay. And then for cranial nerve 12, we're gonna go ahead and I'm just gonna have you stick your tongue out. So go ahead, and you don't even have to leave your mouth open all the way. You can just stick it out like this. And then go a little bit further. There you go. And then here I'm just looking if it deviates one way or another. If it did, obviously that'd be abnormal, and then we'd have to look into that further. But other than that, everything looks a-okay.